We can peer deep into the eye, deeper than most ever imagine. Behind that small window of light, we see not just vision, but the very edges of the brain itself. We can detect swelling of the optic nerve, signs of dangerous intracranial pressure, the earliest evidence of a tumor that, if left untreated, could claim a life. We know what we're looking at. We understand what it means. And yet, here, in Puerto Rico, our hands are tied. It's a cruel paradox. The very professionals trained to recognize these conditions, optometrists, are forbidden from prescribing the treatments that could stop the damage, ease the pain, or save the patient's sight. We can diagnose a life-threatening disease, but we must watch in silence as bureaucracy blocks us from acting. Why? Not because science says so, not because evidence demands it, but because politics, petty, outdated, protectionist politics, has built a wall between knowledge and care. In every one of the 50 states, optometrists not only detect, but treat. We prescribe, we manage, we prevent. Patients receive complete care in a single visit. But cross this invisible colonial line, and suddenly the same education, the same training, the same medical judgment is declared insufficient. Here, the law tells us, you may know what's wrong, but you are not allowed to fix it. And who suffers from this injustice? Not the institutions, not the lobbyists. The patients do. The grandmother with optic neuritis who could lose her sight. The young soldier with papilledema whose tumor could be caught earlier. The diabetic patient with a retinal infection, waiting for a referral that may come too late. We entered this profession to help people, not just to see problems, but to solve them. Yet in Puerto Rico, we are forced to stand on the sidelines, shackled by an antiquated law that refuses to see us for what we are. Primary eye care doctors. This isn't about turf. It's not about titles. It's about logic, justice, and the right of patients to receive timely, competent care. To those who say optometrists are just refractionists, I say, spend a day in our chair. Watch us diagnose a tumor before it spreads. Watch us save a child's vision. And then tell me we haven't earned the right to finish what we started. This poster isn't just a statement. It's a mirror reflecting a disgraceful reality. A U.S. territory where science bows to politics, and patients pay the price. But the truth is louder than any lobby. And we will not stay silent. Because this isn't science. This isn't reason. This is politics. And it must end.